Everybody, welcome to my channel. My name is Talia. For anyone that is new, welcome, welcome, welcome. For anyone that has been continuing to follow with me, hello, how are you? So today I want to talk about Diastasis Recti, how you can get it, also what does it look like. So for anyone new to my world, new to my channel, let me just briefly go over just who am I, why the hell should you listen to me? So first off, I have been a personal trainer and group X instructor for 10 years. I have owned a gym, a franchise gym for 7 years, and I just closed my gym about a year ago at the time of this video after the birth of my third child. And so that has led me to this video today of what is Diastasis Recti. So I have learned so much about this, of course, as I'm living through it, but also just throughout my studies as a, again, healthcare professional in this realm of fitness and wellness. And so ways that you can get Diastasis Recti. Kids, yes, our cute little cherubs. They destroy our bodies inside and out. And if some of you lucky moms were able to bounce back from it, I am oh so jealous of you. I was not so lucky, and I am a trainer. So I got the short end of the stick. So for me, in my case, I do believe that it has been a genetic issue in my family because my brother was born with a hernia. My father has also gotten a hernia and Diastasis Recti, not the same, but he has that as well. So according to my OB at the time, it can be a genetic thing. So essentially, if it is a genetic thing, that means I already had some kind of a separation in my core, whether I knew it or not, and therefore I just needed some event, again in my case babies, to make that gap a little bit wider, and alas, here we are. So this can happen to men or women. Keep that in mind, it's not just a woman thing. However, for women, a lot of women may not be aware that they even have it. Some may not be as pronounced as mine, but some could be smaller, such as a 1 finger, 2 finger, anything in between or higher. And so when I say that, I mean my abdominal separation, for me personally, is 5 fingers. Yeah, so my gap in my abdominals is that wide. Hence why I look like this. And again, I am done having babies, my friends, but I still look pregnant. So if you still look pregnant, this could also be potentially an ailment that you're suffering from as well. But I also, in turn, have a hernia because of my abdominal separation, the Diastasis Recti. So for some women, again, you could go to physical therapy, you could narrow that gap if it's not as wide. However, in my case, because my intestines from my hernia have kind of pushed through that, I continue to look pregnant. When I do lie down, it does not look as pronounced as this, but this is what it is. It's not going to change in my case. So therefore, I have opted to do a plastic surgery, cosmetic surgery, we'll say, and it is a tummy tuck. So I opted not to do mesh because I just did not want something foreign in my body. That was my choice. You do what's best for you. Please talk to your healthcare professionals and have those conversations. I am not telling you what to do. But I did not want to do that for myself because I just felt, hey, watch, I'll be that 1% that has some kind of issue. So I just didn't want to go that route. I opted to do the full tummy tuck because even if they fixed the hernia, I still would have extra skin. And for myself in this profession, I just don't want that. I just don't, okay? So I personally do not believe that there's anything wrong with looking good, feeling good. If that makes me vain, oh well, then I guess I'm vain. But besides that, I do get low back pain. So as I'm teaching classes, it hurts my back to do push-ups on my feet. Tired of that because the weight is bringing me down, the gap, and gravity continues to bring everything down. So again, it's just too much pressure of everything going down. So it is not fun for me. Also, I can't do core work for too long because that hurts my back as well. So basically anything belly down, hands down is not good for me. So I can't plank well, so I have to always do modified, which again, nothing wrong with it. I just know what it was like before my kids, and that was not a problem. And then also my clothes. I wear big clothes now because I just have this gap, and for me mentally, it was just too much for me. So if you're in a similar situation, I feel you. I understand. You need to do what's best for you. No matter what anybody says, you need to do what's best for you, whatever that may be. But I do encourage you to have a conversation if this is something that's really bothering you. So let's get back to diastasis recti. So as you can see, this is what it looks like for me. So I still look 2 or 3 months pregnant and I am done with babies. So again, this is what it looks like also. So when they go in and they're going to fix the diastasis, my stomach will, because this is where my C-sections were cut right here. So this will all be gone. It's going to be all nice and flat here. So that is the choice that I chose to do. How can you check for diastasis recti? That's going to be in a separate video. But again, if you suffer from any type of abdominal separation, again, if it was a smaller hole, you might feel some pain if you lie in your stomach. That has not been the case for me, but if that is you, I highly encourage you to speak to your doctor as soon as possible, because there could be more going on if it's really painful. However, I do not have pain, so I kind of let this go. However, my son is 1, so they would not have done too much on me since he was so young, but it's been well over a year, well, 14 months. He's 14 months old now. So now it's okay. It's safe. No pregnancy hormones, should be good to go. So we're doing it in 11 days. So if you can continue to follow my channel, I am going to show videos of before and also the during of my plastic surgery recovery, because for 2 weeks it's going to be hell, but we're going to do this because I need to do it for myself, my mental health, my well-being, and just to fit in my clothes again, not get low back pain, all of those things. It's not just for the aesthetics and all of that, but I am so excited for it. It's going to be right before Christmas, but that's okay. Just one Christmas I will be sidelined, but the rest I will be fine with the body that I truly feel like I deserve and paid for, but that's okay. So stay tuned, more videos to come. I have 11 days. My countdown is on, and I will talk to you in